Hi, I'm Michelle and welcome to Pelvic Exercises. This is the second episode in our series to help you strengthen your pelvic floor. And today we're looking at how to feel Kegel exercises, and I'm going to give you some nice little tips you can try at home. Before next week we look at how to strengthen your pelvic floor muscles most effectively. So, remember last time I talked to you about how to feel your pelvic floor muscles working, and we talked about that correct Kegel action being a lift and a squeezing action in and around the pelvic floor muscles, in and around your pelvic openings. So it's a definite lift and squeeze inside, and it's a definite lowering down of those pelvic floor muscles. And remember we talked about the muscles being positioned between the sit bones and the pubic bone and the tailbone. So that's the action you feel inside your body. It's not an external exercise at all. All the action takes place inside your body. So, some things you can do at home to help you feel your Kegels. The first thing you can try is to try and stop the flow of urine once it's started. So, next time you visit the bathroom, you might like to see if you can actually slow the flow, or better still, even stop the flow. Now that can help you to know how strong your pelvic floor muscles are, and it also can be a great little measure or a little test over time to see if your pelvic floor muscle strength is improving with your Kegel exercises. Always remember that that's not an exercise to practice regularly, once a week at most as a test, and if you have problems emptying your bladder fully, that's not something that we recommend that anyone do at all. So just a little lift and squeeze in and around your pelvic opening. See if you can slow that flow next time you go to the bathroom. The second technique you can try is to imagine you've got to pass gas in a room, and you really want to stop that embarrassing wind from passing, and so again you're drawing up through the anal area, lifting and squeezing inside and lowering down. And perhaps you can imagine that at home now, or even feel that tightening and lifting in and around that area, and then a relaxing back and down. So these are just little techniques, little cues to help you find those muscles and to feel what should be happening. The third thing you can do is use a hand towel. I've got a hand towel here, you can see, and so you can use a rolled up hand towel or a small bath towel. And if you were to sit on that bath towel astride, so that your pelvic floor muscles in that pelvic floor area is actually positioned, I'll just show you there. You can sit over the hand towel like that. Then you can actually feel your pelvic floor muscles working. Often you can feel the exercises most effectively, and I think it's because you've got a reference point to lift away from. You can see today that I'm actually sitting on a fit ball here. So when you sit on a fit ball or an exercise ball, and particularly if you lean forward on the exercise ball, if you try to lift and lower through your pelvic floor, through those pelvic floor muscles with your Kegel exercises, often that helps you to sense where those muscles are. Again, it's the shape of the ball against your pelvis and your pelvic floor that helps you give a reference point to lift and lower away from and towards. Now, if you feel comfortable feeling your pelvic floor, there's another two nice little techniques you can try at home. The first is to feel your perineum. So remember, the perineum is the area of tissue between, if you're a woman, the vagina and the anal area. And when you do a Kegel exercise, that area should lift slightly. It shouldn't bulge downwards. If it pushes downwards, well then you know that you're not performing your Kegel exercises correctly, and stop, because you can actually make things worse. This exercise, or when you feel your perineum, it might be over your knickers or under your knickers, washed hands under your knickers, you feel an inward lift and a lower down with your Kegel exercise. And if you feel comfortable feeling inside the vagina, you can lubricate, wash your hands, lubricate an index finger, and use the finger against the back wall of your vagina. That's the wall that's closest to the anal area. And you should feel that area lift slightly and lower down with your Kegel exercises. And you might use those techniques, that feeling technique, for your first few exercises, and see if you can go ahead with those exercises on your own without having to feel the muscles. Often as you get better and as the muscles start to get stronger, there's less need to actually feel what's actually happening. So we've gone through some nice little techniques there to help you. Thinking back to what we actually started with, we talked about how to stopping the flow of urine. We talked about stopping wind, or imagining stopping wind from passing. We talked about using a hand towel to sit on, or sitting on a fit ball. And we also talked about some nice little techniques to actually feel the pelvic floor muscles working inside. So our next episode is on just how many exercises you need to do to strengthen your pelvic floor. So subscribe now. I look forward to chatting again with you at that next session. Bye for now.